Good afternoon. I would like to begin by thanking the University of Bologna for organizing this congress and giving me, a second-year doctoral student in audiovisual communication from Madrid, the opportunity to present my preliminary research. In his work, A Theory of Semiotics, Umberto Eco established a theory of codes that attempts to explain the cultural organization of any meaningful system. Here we would like to apply this theory to the initial diagnostic code for COVID-19 in Spain, defining COVID-19 as the disease caused by SARS-CoV-2 virus. To this end, we have reviewed the literature published by the Spanish Ministry of Health between January and April 2020. However, due to time constraints, I will focus only on the first procedure published on January 24th. Umberto Eco explains that a code establishes the correlation between a plane of expression and a plane of content, and provides an example of a water-gate model in which an engineer receives information about the given state of the water, and therefore, according to previous conventions, knows or decides that he must respond in a given way. Can this be applied to the health codes of a semiotic emergency? First, I would like to begin with a famous quote from Umberto Eco that we heard before. Semiotics is in principle this discipline that studies everything that can be used to lie. And we can add not only to lie, but also to depict misunderstandings. Why have I put this painting of Poussin, landscape with Pyramus and Tisbe, on the screen? Because Pyramus has one of the worst possible encounters with semiotics. Upon seeing Tisbe's veil with blood, he makes a false inference that blood is Tisbe's and Tisbe is dead. This false inference becomes a self-fulfilling prophecy. Because Pyramus commits suicide due to this misunderstanding, Tisbe will ultimately die for real, since she too will take her own life. It can be obvious to say that ontology is not epistemology, but sometimes we have to remind the obvious. And when we want to study COVID-19 phenomena, we must take this very seriously. What things are in reality, regardless of the observer, is something different from what human beings can observe, know, name, and categorize. Kant's Copernican revolution already showed us that human beings do not access reality directly, but rather organize their experience of phenomena through a priori forms, space-time, and categories. In the context of COVID-19, we take this a step farther, since in epistemology, the way we define and measure phenomena also affects our understanding of them. In this regard, Professor of Medicine John Ioannidis tried to warn us on March 12 when he said the following: part of the growth of the documented cases could reflect rapid increases in numbers of coronavirus tests performed. The number of tests done depends on how many test kits are available and how many patients seek testing. And before concluding this theoretical introduction, I would like to ask you, when we spoke of a new virus at the beginning of the COVID-19 crisis, were we referring to a new virus in the ontological or epistemological sense? Was it new because it was new to us? Or was it new because it didn't exist before and only began to exist when it became a phenomenon for us? And here we delve into Umberto Eco's book, A Theory of Semiotics. This is page 51 of the English version, where we can see a table that refers to the water-gate model example, which Eco uses to illustrate the theory of codes. Here we can observe the continuum of physical, material reality on both sides of the table, and the continuum of light illuminating the lamps as electrical phenomena that ultimately have meaning for the technician regarding the state of a dam. Therefore, on the other side of the table, we have the continuum of the water levels in that dam, and each water level represents a level of the dam's contents, ranging from danger, alarm, safety, and insufficiency. Here is a small table, a small sample of the evolution of the signifiers and signifieds of the COVID-19 disease. Initially, the media and the WHO referred to it as pneumonia, and this gradually mutated to respiratory disease, and from there to the official name created by the WHO on February 11th, COVID-19. But it's not just a mutation of the signifiers. The meaning also changes because we are witnessing the shift from the disease as pneumonia, in a binary sense of you have pneumonia or you don't have pneumonia, usually diagnosed in a hospital by a doctor with x-rays, to a spectrum of respiratory symptoms of varying severity. And even later, the possibility of having no symptoms at all, of being asymptomatic, was acknowledged within this spectrum. I want to emphasize this. What is striking, unusual, relevant, and widely reported internationally, for example, by Reuters on December 31, 2019, is an outbreak of pneumonia of unknown cause, not an outbreak of mild cases or an outbreak of asymptomatic cases. We are not only facing mutations in the meanings and signifiers of the disease and the virus in a very short period of time, of 2 months, but we are also facing a change in the hierarchical preponderance of different codes, the clinical code and that of molecular biology. During the first 12 days of the crisis, when the news is disseminated until the virus is isolated and casualty is affirmed, we are dealing with a clinical code, based mainly on signs that are empirically observable symptoms. Then on January 7, the virus was isolated and the genomic sequence was shared on January 12. And there we enter the realm of another code, the code of molecular biology, where the semiotics of the entire sequencing process of the virus RNA takes center stage in order to later develop a PCR test, a polymerase chain reaction test, that determines whether certain genetic primers previously associated with a virus are present in a respiratory sample. The first thing I must do is present this document to you. Procedure for managing cases of infection due to the novel coronavirus, dated January 24th, 2020. It was created, judging by the symbols on the documents covered, by various agencies under the Spanish Ministry of Health. It also proposes a case definition for infection by the new coronavirus, at that time called 2019 nCoV, based on epidemiological, clinical, and laboratory criteria that are based on 3 different codes. Epidemiological and clinical criteria were used to select the people who could be investigated to see if they had or did not have the infection by the new coronavirus. But what really defined whether or not someone had that infection was the laboratory criterion, 2 positive PCR tests at that time. That was defined as a laboratory confirmed case. According to this procedure, if someone met 1 epidemiological criterion and 1 clinical criterion, these 2 PCR tests have to be done. In other words, going back to the book A Theory on Semiotics, we can say that from the continuum of the Spanish population, 49 million people, the procedure based on 3 different and hierarchically related codes selected possible candidates to have a positive diagnosis of infection by the new coronavirus. According to the code of January 24th, only people with symptoms could test positive because the code did not allow for testing asymptomatic individuals yet. In other words, the code, in a way, defines what can be found. It's a limit to the continuum. The continuum, the ontological level of what the world truly is always excluded. That's why it's so important not to confuse ontology with epistemology, or new as newly discovered, or new as something that didn't exist before. The initial clinical code used during the first 10 days of January was binary, having or not having pneumonia of unknown cause. Furthermore, it was defined in negative terms. It was pneumonia that required testing, the molecular biology code, with a negative result to rule out known diseases. It's not this, it's not that. The molecular biology code implemented from January 12 onward, based on the isolated sample from a worker with pneumonia at the Wuhan market, is different. It no longer focuses solely on the initial clinical presentation of pneumonia, but rather creates a new binary system with a PCR test, being positive or negative for infection with the novel coronavirus, based on a threshold number of cycles or amplifications. It's logical to understand that if the code had been limited to applying the PCR test only and strictly to suspected cases of hospital-acquired pneumonia, the number of cases worldwide and in each country would have been lower because the radius of the continuum would be smaller. In other words, the code's criteria for selecting from the continuum guide and influence the results themselves. And in fact, the WHO acknowledges and defines this fact by naming the disease not pneumonia, but coronavirus disease, a tautological name that doesn't refer to any disease outside of itself. What is coronavirus disease? Coronavirus disease is testing positive on a PCR test by the code's own semantic definition, with or without symptoms. It is a spectrum that goes from having nothing to death, depending on which section of the continuum you are focusing your attention and which token content unit you are using. In the January 24th code, the continuum selected individuals arriving from Wuhan, and subsequent codes expanded this to more places outside of Spain. However, in February 27th, code marks a fundamental milestone, as it states that PCR testing should be performed on any hospitalized individual with severe respiratory infection, pneumonia or even death, in whom other possible infections etiologies have been ruled out. People that had not been in Wuhan or Italy or other places. This changes everything because you are giving a new meaning to something that you were not worried about before. We are adding, in Umberto Eco's terms, a new token content unit which represents selected elements cut from an imprecise continuum of facts or notions. I would also like to point out problems in the code that were acknowledged a year later, in 2021, when it was stated in another official document that PCR has been used controversially because of its ability to detect viral RNA for very long periods that cannot always be linked to infectious viruses, which raises numerous doubts when it comes to taking public health measures. But that was published in 2021. Also in 2021, we found such surprising statements about the lack of standardization in terms of the code, since on the one hand, it is said that a high PCR cycle threshold of 30 to 35 would be a viral load without infecting capability, but that each laboratory must validate this and define what is high or low viral load. Each laboratory. As we can see, diagnostic codes are more ambiguous than we thought, even within the world of science. Certainly more ambiguous and complex than in the ideal example presented by Eco in his work, in his book. Depending on how we define the relationships between units, system of the continuum group to which they are applied, the disease can be understood in one way or another. Similarly, if the definition of COVID-19 had been maintained solely as pneumonia at the clinical level, we would have discovered far fewer cases. That's what happened in the first SARS crisis of 2003, which was always defined as hospital-acquired pneumonia. No one was interested in this spectrum of symptoms. In this regard, I would like to conclude with another quote from Eco. One must also accept another condition of the semiotic approach, which will not be like exploring the sea, where a ship's wake disappears as soon as it has passed, but more like exploring a forest, where car trails or footprints do modify the explored landscape, so that the description the explorer gives of it must also take into account the ecological variation that he has produced. In a health crisis, it's obvious we need doctors, scientists, laboratory technicians, but disciplines such as semiotics, philosophy, logic, and linguistics have much to explain and analyze, because we all, even in science, need to use codes, signs, metaphors even, and all their ambiguities to communicate. As Eco said, since people speak to explain why and how they speak cannot help but determine their future way of speaking. Thank you very much. And I apologize for any mistakes I may have made due to my inexperience and gaps in my semiotic training and my bad English.